Welcome to the Wellness Revolution podcast, the radio show all about wellness in your mind, body, spirit, personal growth, sex, and relationships. Stay tuned for weekly interviews featuring guests that have achieved physical, mental, and spiritual health in their lives. If you'd like to have access to our entire back catalog, visit drveronica.com for instant access. And here is your host, Dr. Veronica.
I'm Dr. Veronica, medical doctor, medical intuitive, and I'm here to help you have the best health you possibly can. So, I like to give you a little tips and bring on wonderful guests to you, but I always got to just talk to you ahead of time because there's so much going on in the world. We have to talk about what is making people ill and old and cranky. There's so much going on. I don't even half the time want to turn on the TV or log on to the internet or even look at my phone because with these smartphones, everything pops up because there's so much horrible stuff going on in our country and around the world. Now, you're going to say, well, which one is this that you're talking about? Exactly. This is the problem that we're running in today. So we're watching our presidential election. We're watching elections around the world. We're seeing people massacred in clubs, in the streets, all over the world. We have it where it is that the police, who we used to feel are the good guys, we don't know anymore. And we're all scared of them. And it used to be, I'm African American. It used to be that we were scared of the police, but I'm seeing the police that are killing everybody all the time. This is insane. But on the other side, there's so much hate going on in our culture. It's just really scary. You're watching people around the world in Western countries where we have everything we possibly could ever want. In America, the poor people are rich. And if you're poor and you're saying, how can you say that? You need to really step into a third world country where they really are living on $1 a day and realize that those people are happy and wealthy in spirit, whereas we in America are not that way. We just are that way. We have all the opportunity at our disposal. We spend the most money of any country in the world on our health. We have access to what we consider the best doctors in the world. And we do have a magnificent medical training across the board in all areas. Even, I'm not just talking about MDs and ODs. I'm talking about naturopaths and chiropractors and Reiki masters. And we have all of this here in the United States. And we all who go into training, I ask people, how much do you feel I've spent on my medical training? When I give you my knowledge, and that's what I do, when I bring in people and I coach them, when I give them my knowledge to shortcut them so they get a quick way up the pathway to wellness, I say, how much do you feel that I've spent on my medical training? And I said, you think I spent, $250,000? Yeah, we know doctors come out. I said, okay, well, let's just talk about school. You come out of school and by now, I've probably spent a good $500,000, real dollars, on my knowledge so that I can help more people from an academic perspective. But there's all the time and effort that goes in behind the scenes in which we're thinking about how to help you better. And then I'm also going to conferences to learn from fabulous people. Some of the fabulous people that I meet at these conferences, which are sponsored by just all kinds of people. I don't go to pharmaceutical conferences anymore, but I do go to supplement company conferences, which are absolutely excellent. And I meet practitioners who are on the same mission that I am, helping people be well, not just in their body, but in their mind and spirit. But guess what? We're down to the pills. We are addicted to pills. Now, you're looking at people like Prince and like Michael Jackson who died of drug overdose, Amy Winehouse. I mean, you just name it, who died of drug overdoses. And some of these people we looked at as having a clean life, such as Prince, who was famously known as a Jehovah's Witness and a vegetarian and wouldn't even allow alcohol in his house. we now know he died from a fentanyl overdose. Now, I got to tell you some stories about fentanyl before I bring on. You guys know my first training in medicine was as an eye surgeon, and I used to operate under local anesthesia, and we used to do everything we could to make our patient under there be comfortable, because you can be anxious with surgery. You understand that. I understand that. And fentanyl was my drug of choice. Fentanyl was my drug of choice. Now, I have never taken, actually, I had surgery once and I had fentanyl. I asked them to give me fentanyl. I said, give me the fentanyl, or give me the Remy fentanyl, because that's even better than the fentanyl, because I saw the effect that it had on reducing pain and anxiety and a little bit of amnesia surrounding the surgical experience. And so I wanted my clients to have that, because I wanted them to be as comfortable as possible while I was restoring their sight. As a cataract surgeon or a glaucoma surgeon, that's the type of surgery I did. And people are awake while we're operating. So you got to keep the environment very relaxed and controlled, because otherwise you have a lot of anxiety going on, and their anxiety ends up being my anxiety. And that can lead to, what do we call it? Complications. And we don't want that. We want to restore your sight. So America, here's what's going on. Now, doctors are the drug pushers. And we're not just I'm not just talking about narcotics. I'm talking about Lipitor and Norvasc and metoprolol and Synthroid and all those other things that you consider that are good, but that are poisoning you. And there's another way to do it. America, stop looking down on the heroin activists. Stop looking down on the princes of the world. Stop looking down on the Michael Jacksons. Stop looking down on that poor brown drug addict in the park and thinking you're never like that, because you are addicted to your pills. And when anybody says anything about taking away those pills, you want to fight tooth and nail. And that's how the political system keeps you voting the way they want you to vote. Now, having said that, I have a wonderful practitioner here who I will call one of my teachers, because I went to a conference and I met him and I said, this guy's fantastic. I had to get him on because I want to share his gifts with people who know there's another way and there's a better way. And so there's those of us who are committed to being well in body, mind, and spirit. And which starts with what we put in our body as far as food. No medicine, no amount of exercise, no supplement can overcome a crappy diet, first of all. And that diet, that eating strategy that you're using is different for everybody. There's 7 billion people on the earth. And so there's 7 billion different ways to do it. And this is why you need help. And so all of you who have medical degrees from University of Google and refuse to get help, this is why you're sick. Because you're not getting help from me and people like Dr. Robert Silverman, who was my guest that we're going to talk to in a moment. Go admit that you don't know and go ask somebody who does know. We've dedicated our life since I was 4 years old. I said, I'm going to help people. And Dr. Robert Silverman likely has a similar story. He is a chiropractor and he has so many letters behind his name. It's just like, if you see it, he's got more letters behind his name than the alphabet. Seriously, he really does. And so this is not just, we love to learn, but we love to learn because when we learn something, then we go to our clients the next day and we can help them do it, whatever it is, better. So I want to introduce to you Dr. Robert Silverman. You can go to drrobertsilverman.com. He is a chiropractor. He graduated magna cum laude. We all love when somebody has the honors graduation behind it. But you know, an honors graduate doesn't necessarily make a good clinician. A good clinician is somebody who can get you the results that you need to do. Results. And so people want to say, Dr. Veronica, how do I know you can do what you do? Go to my website and look at the testimonials of the people talking about it. Go look at the people whose lives have changed, who you can feel their energy. And Dr. Robert Silverman is also one of these type of people who can help you change. Kettlebell certified. He's not just a chiropractor. Kettlebell certified, CrossFit trainer, rock tape. I love rock tape. That got me through my run after my knee injury. My trainer did fascial release therapy, did rock tape on me, and this morning had me doing sandbags and the kettlebells. Dr. Robert Silverman, I got to let you know that. After my insanity workout, and then a little bit of spin. I was in there doing, you wonder why I look the way I do at the age that I am, and you can't figure out the way I am. And I had trouble getting a guy that was age appropriate. Everybody was so young. It was scary. Anti-aging. That's what we're going to talk about with Dr. Robert Silverman. He's been all over the TV, Fox and Friends, NBC, CBS, Newsmax. Dr. Robert Silverman, welcome to Wellness for the Real World.
Good morning. How are you?
I'm great. Is there anything else that I missed about you?
No, I should talk about the handicap, but thank you so much.
You know what? Let's talk about the handicap because we want to talk about anti-aging because everybody wants to know how to stay young. But let's talk about the handicap because, all right, I've been with you. I've noticed something, so tell us what's going on with the handicap.
Well, I was talking about the golf handicap, but you're talking about, what drove me into healthcare was I have what we call congenital torticollis, so my neck is slanted to the right. And it was tough. I grew up in the Bronx in New York. It wasn't great not fitting in, if you will. So that drove me to alternatives to seek out versus the medical field, which I have a lot of respect for. That drove me to alternatives, and that originally drove me into chiropractic. And then chiropractic, got me into that critical thinking mode, believe it or not, and saying, well, how do I fix the body inside out? How do I help the masses? And that's when the term functional medicine, functional nutrition really dawned on me, to help people fix their body from the inside out. And, which you alluded to, all the issues that we have now in America with the university, or if you will, the United States of diabetes, and everybody getting diabetes and obese.
Yes.
I mean, I don't need anybody to speak their language or move. I can just look at them and tell them what country they're from.
I'm about to go to France, and the people all there look beautiful, and we wonder why. Because first of all, I want to ask you, do you feel one of the problems that's going on with Americans is that we're so smart that we don't listen to the people who have real education and authority and look for the other voice of reason?
You know what? I heard you say two things that were so compelling. I wrote them down. I'm going to steal them from you, but I'll give you credit. Number one, I always say something similar. Don't let your Google search get in the way of all my degrees and experience. And a lot of people do that. Google's powerful, but can also be an issue because they read something, and the question is, where do they get it from? And who do they have it from? And the other thing is, yes, we're so educated, but we don't listen to other people like yourself who are educated and experienced in a field. Remember, science bridge to application will lead to results. The evidence is in the patient. So that's part of the problem. We're not good listeners.
Yes, not good listeners. But we also, when we are looking for a result, we don't know what is a good result and what is not a good result. And so you have people who go to their conventionally trained practitioners with all the degrees on the wall from the best training, who put them on a medication which can cause all kinds of havoc in their body, such as muscle breakdown and liver problems and blah, 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 i.e. statins and all its sisters and brothers. And we think because the number came down, it's all fixed. And we call that a good result. Comment on that.
Well, I think you're able to really speak to what I'm about to say. I think we now, as functional medicine practitioners looking at the body from the inside out, are always looking to treat the system. I think some of the issues that most doctors do is they treat the symptom, and that's where the patient is. There are thousands of symptoms. You probably memorized them all when you went to med school. I had to learn a lot in myself going to chiropractic school, but there's anywhere from 11 to 14 systems.
Yes, we need to treat the systems. And so we're a whole person. Let's talk about some of the body systems and what keeps people young. And so what I've noticed traveling in the functional wellness world, I don't even like the word medicine anymore. People say, what do you do? I'm a functional wellness specialist. That's what I tell them. I don't like the word medicine. But one thing that I've noticed traveling in the functional wellness world is that the people, by and large, are very youthful appearing. And so when I go in traditional medicine, people are just kind of old and broken down and look like the rest of the American population. But when I travel in the functional wellness crowd, everybody's very youthful, not just in their appearance. And yeah, some people look older and blah, blah, blah. Yeah. But usually if they look older, they're probably 20 years older than what we think they are. And there is a system to anti-aging that works, which conventional doctors haven't been taught necessarily and are not giving to their patients. So tell us about some anti-aging strategies that you know and that you give to your clients.
Absolutely. I always like to talk about it in the Magnificent Seven. Number one, functional movement. Move well, keep your joints health well. So functional movement is, if a patient walks in, I can see how they sit if they're bending at their lower back versus moving at their hips. And then they say to me, well, I have lower back pain. Of course, you're overusing it. You're not moving well. My dad always used to tell me as an example, he said, when you lift everything up, that big box, bend your knees. Well, that had a right intention, but it was the wrong movement pattern. Bend at your hips. So move well first, then move often, and you'll have better joint health. Another concept is the body composition. Well, to speak to obesity, body composition. So we're just too heavy in America. We're carrying too much weight. We're carrying too much percentage of body fat. Some of the things that we have as we age is the loss of muscle mass, sarcopenia, if you will. Protein synthesis, our ability to make muscle, changes at 40, much to my chagrin. At 40, don't tell anybody. I stopped at Jack Benny's age at 39. That's a
haven't
family
we all?
trait. Yeah, God bless that. Absolutely. So part of the problem is that our inability to use all these amino acids from the foods we eat, we're not able to go through the proper pathway, so we have to add specific nutrients like an L-carnitine to add with protein synthesis and allow us to put muscle on. Telomere length, which is a whole conversation in its own. Essentially, telomeres are the protective tips of our chromosomes. So if we can't protect our DNA and our chromosomes, we're going to age quickly and poorly. Blood sugar. That's a whole nother topic, blood sugar. Again, the United States of diabetes, the average American eats 152 pounds of sugar per year. So with 50% of Americans going to have some form of blood sugar dysregulation by 2030, we've got to help people stop consuming sugar and clearly enable people to break the sugars down. Whole body alkalization, we're too acidic. All cancers grow in an acidic environment, more alkalization, more vegetables, more fruits. Detox, and I know we're going to go into more detail in detoxification. Everybody should be detoxing. It's not a question of if, it's a question of twice a year. And finally, change our lifestyle. Change all your patients' lifestyle. Get them moving, exercise. I mean, when you see the studies that talk about we spend 41% of our time now on technology, about 30% of our time sitting, and less than 1% of our time exercising. If you knew what I knew, you would really be standing listening to us on the radio, possibly walking.
Uh-oh, I'm about to stand up right now. and I'm standing up right now. I got to stand up. Now, I'm probably not the person that needs to stand up, but I'm standing up here. I'm going to hone in on some of these issues because they're what I see every day in the questions that people ask me. I'm going to sit back down with your permission.
Absolutely.
Okay, so let's talk first. I'm going to jump around a little bit, and I know you can talk off the cuff because I've seen you do it. Healthy blood sugar regulation. One issue that a lot of people come to me and they say, sugar, it's really a problem. I can't give it up. And I understand. I say to them, yes, I understand. Think of sugar. It's like an addiction. And if your nervous system is out of balance and your hormones are out of balance, you're going to want that sugar all the time and think that you cannot resist it. But you can, and we can get your body in balance where you don't care necessarily one way or the other. You might have it sometime, but you're not going to go off the deep end. Let's talk about sugar because everybody associates sugar in and of itself. That's not the whole story with diabetes, but too much sweets, too much sugar, you're sweet, your blood's sweet, you have diabetes. How do you help people get out of the sugar addiction? Because if you're not addicted to heroin or you're not addicted to Lipitor, you're addicted to sugar, salt, fat, or something else that's getting in the way of your health.
What a great analogy when you think about it, because they did a study between cocaine and sugar, and they gave it to mice, and they
sugar's
found
worse.
that the mice preferred the sugar 94% to the cocaine. So you just asked the hardest question in the world. It is addictive. However, everybody needs to cut it down slowly if that's the issue. I mean, we have some new dietary guidelines that people should be consuming less than 10% of their calories from sugar. The average American consumes 15% of their calories from sugar, most of which is from high fructose corn syrup, which, they have those hidden labels now for. In addition, we're consuming 146 pounds of white flour. So the average American is consuming more sugar or white flour than their body weight. So what I do with the blood sugar regulation is I ask them to cut it down, and what I do is I have them make better choices. So a better choice for sugar clearly would be a fruit, clearly a vegetable, and I recommend some supplements, and I think we can talk about the supplements because I know you're privy to them. We talk about specific supplements that have nutrients that help with sugar regulation, like L-carnitine and chromium, and some of the B vitamins really do a great job, alpha-lipoic acid. So I usually start them on that, and I get them on a portion size. I always used to say everybody likes that family-style plate, except they're eating the whole family-style plate. So smaller meals, proteins from the size of your hand, and a nice mix of all the macronutrients, and eating small meals throughout the day. I think that you would probably recommend all of what I've mentioned.
Yes. Now let me go a little bit more deeper into the sugar and what people are eating. Let's talk about fruit. One issue with fruit is some of it is very high in sugar and other is not. Now, I recommend that people eat a variety, but what I've noticed with people who are on the spectrum of the insulin resistance or going into the diabetes is they love the really sugary ones. Here we are, summertime, watermelon, mango, all those type of things that are pretty dense in sugar. Grapes, they're little sugar bags. What do you tell your clients about going towards fruits that are not going to have as big of an impact?
Great point. Now, the fruits that I recommend that do not have that sugary, high glycemic impact are typically something like an apple and berries, really high on the total ORAC scale, getting a lot of antioxidants, which decrease free radicals. Those are my choice fruits because, as you were trying to allude to, fructose, even in fruit, is what we call the sneaky carb. It goes to the liver and then raises the bloodstream. So it has a negative dual purpose. However, berries and apples are very low on the glycemic index, and they add some taste to a meal. So, one apple, a cup of berries a day, that should be fine for everybody to get the nutrients that they need.
Okay, so people, when you're making that smoothie, a half a cup of fruit and a whole cup of vegetables is probably what you should be doing, and not 2 cups of fruit. I just want to make that clear because we're now all smoothie and juicing and all that other type of stuff. Let's talk some other information. This is just plain old everyday stuff to you and I, but not to the American public. Sugar alternatives, sugar substitutes. Now, there's a couple that I tell people, here's what you can have, and here's why you don't want to have that. First, why are the sugar substitutes so harmful and worse probably than just plain old sugar?
What a great question. They did a study of the saccharin, the Splenda, and the NutraSweet, the aspartame, and what they found out was, one, it damages the individual's gut microflora. So 70% of our immune cells are in our gut. So that alone causes increase in diabetes. In addition, what's fascinating about them is the brain senses them as sweet and assumes that there's going to be carbohydrates with it, and the body starts releasing insulin. Now, in addition, something like a NutraSweet aspartame crosses the blood-brain barrier and is a neurotoxin. And with all the issues and the conversations we're having about brain, it's very adverse. Saccharin has raised the incidence of bladder cancer in animals, and Splenda actually is higher in the glycemic index than sugar.
Wow. And so I recommend to my clients a little bit of stevia. Now, one thing that I've noticed is as I transition them to a more healthy diet, their sugar cravings go away, as well as their taste for the sweet stuff. So sometime I'll recommend, I'll say, add a little bit of stevia. If you don't like it, do that. And about after a week or two, they don't necessarily even need to add anything 2 different, concoctions I'm asking them to drink or taste or something like that. What about honey and agave and that nature of, because people say, I'm going to do natural, so agave, or I'm going to do honey, and the real health conscious people like, I'm getting raw honey and manuka honey. What are the issues with honey and agave and ones like that?
It's funny. I wholeheartedly agree with you with the stevia. The literature is real positive at this point. It's very prodigious. I'm very down or negative to agave because originally we said it was a low glycemic index honey, and now we found out it was being extracted from the cactus, and it's actually considered in the body because it's so concentrated in fructose, high fructose corn syrup, so it's a negative. Stay away from it. Let's avoid it because we just don't know the source of where we're getting it. No, honey has some medicinal effects, so it's hard to argue with what Grandma said, and it is natural, or at least it should be. However, again, it's high in the glycemic index, and high fructose corn syrup means that it's concentrated with fructose over 55%. So with all the blood sugar dysregulation, I would probably avoid the honey at this point also. I would stick with the stevia. Quite frankly, I have a lot of nutritionists. They probably said they may consume 25 calories of brown sugar before honey and all the artificial sweeteners, as much as we're down on the sugar now, which is sort of mind-boggling.
So I'll tell you what I tell my clients. So you're getting like this great free advice here. I say stevia, and if you're going to go with a sugar, go with the raw sugar. And so that's the 2 sweeteners that I recommend when people have it. If you're going to do honey, you want raw honey, and a teaspoon is all you can have. And a lot of times that doesn't sweeten enough. So therefore they're like, well, why bother? But Dr. Silverman, wait, I got to tell you where to get him. drrobertsilverman.com. I have to have you on again because there's so much that we didn't touch, and we're at the end of the line here. So I want to thank you for being on the show. It's been an interesting topic. I have to have you on again so you know that I will be having my team contact you and say, when can we get you on again? Because we have so much more that we can teach the public. And part of what we do by me doing this, hosting the show, and Dr. Robert Silverman going around and talking and, giving seminars is so that we can teach you how to have a better life. So thank you so much, Dr. Robert Silverman. You're listening to Wellness for the Real World. I'm Dr. Veronica. You can find me at drveronica.com.
Thank you for listening to the Wellness Revolution podcast. If you want to hear more on how to bring wellness into your life, visit drveronica.com. See you all next week. Take care.